The majority of the treatments that we perform include specially designed mouthpieces called neuromuscular orthotics. These are fancy mouthpieces that are custom fitted for every individual patient based on the previous test results and examination findings. The goal of these appliances is to decompress the pressure from the jaw joint by relaxing the muscles and making them stop contracting. This orthotic must be worn 24/7 for at least 4 months in 90% of the chronic patients that we see. One of the most common problems that we encounter with other treatments done at other offices is due to the fact that other dentists will fit patients with these mouthpieces and tell them that they are to be worn only at night. This would be similar to having a broken leg and telling the patient to only wear their cast while they sleep. It does not work this way. Full-time wear is required in order to relax the muscles, decompress the joint, and return the blood and nerve flow back to normal. It can only happen with full-time appliance wear. The most important aspect of this treatment is that the patient must be able to learn to chew food with the mouthpiece, because this is when the most damage to the joint and muscles is being caused. One of the major problems that we see with other treatments today is the fact that some of these mouthpieces are made incorrectly. First, let's start with current treatment methods. Often we see patients who come to our office wearing upper mouthpieces. Now, upper mouthpieces are fine for patients who have mild problems of grinding or clenching their teeth. However, for patients with more advanced and chronic head pain problems, upper mouthpieces cannot be used to correct the underlying symptoms. The main reason for this is that upper mouthpieces cannot be worn 24/7 for 4 months. A patient cannot talk or chew their food with an upper mouthpiece. Therefore, this type of appliance is completely inadequate for the type of advanced treatment that chronic pain patients require. On the other hand, even a lower mouthpiece, such as the orthotics which we have previously shown, they can sometimes be made incorrectly as well. Often, the jaws are not placed in the right position, or the appliance does not provide the adequate support or the adequate and proper position of the jaws. Therefore, it is important for you to understand how critical it is to find a specialist who understands and knows how to fabricate the proper lower neuromuscular orthotic that is to be worn 24/7 for a minimum of 4 months during your recovery period. Another common problem that we encounter with patients that have started treatment at other offices is the fact that the physical therapy needs of the patient are often overlooked. For example, trying to fit an orthotic mouthpiece in a patient who has poor posture problems will lead to a tug of war between the jaws, the neck, and the shoulders. Even if the orthotic is fabricated and adjusted correctly in the mouth, the treatment can often fail if the physical therapy needs of the patient are not met. The topic of physical therapy must be addressed at this point in time. Not all physical therapy is the same. I repeat again, not all physical therapy is the same. There are many issues that cause head and neck dysfunction. There are also many different types of physical therapy treatment programs. In order to understand some of these concepts and treatment methods, we will review the most common ways of addressing these issues. A majority of the patients that we see have an underlying common problem. The head and shoulders are hunched too far forward. As humans, understand that we have undergone a major transformation in the past 100 years. We have gone from farmers and food gatherers to office workers. Our posture has increasingly deteriorated, and this problem affects us in many ways. Head pain, lower back pain, hip problems, knee problems, etc. Posture and strengthening are the key components of successful therapy. The patient must learn how to do their own exercise program and must stay consistent with it. So, let's cover some very basic exercise and posture control routines that you must learn in order to make sure that you are receiving the adequate and appropriate physical therapy program.